Hi, I'm Tony, and today I'm pretty free, so I decided to talk about the basic clinical skills about cannulation. First, I will talk about the equipment. We see here a blue stereo sheet that containing zero tools. I will list later. I will discuss about here in the orange sharp spin in the top left. Mm, That is for disposing used needles and sharps safely. So we will turn to the things in the stereo path. We have here the syringe with flush that contains 10 ml of normal saline. In the center right here, we have the dark blue gauze wrap used for skin preparation or absorbing blood. We have here is extension. It's for connecting the syringe to the cannula. And here is a cannula. In the center left, we have the transparent dressing used for securing like cannula after insertion. We have a sticky pad there. Um, and in the top right here, we have the extension. Extension we already discussed. In the top center right here, that is a steroid dressing pad used for you know to use after insertion. And we have a little thing here is a chloropep stick that we have to snapping it. We have to snap it to open it, and it contains this infection fluid for the skin preparation. And that paper is said here that is a sterile cloths. So we have done. Oh, another thing pretty important is alcohol gel right here. So we could have done the equipments. So for the hands, the patient hands, right here, or the straining like it is kind of mannequin arm, right? The position I will discuss a little thing about that. The palm right here, right? The palm is facing upward, or we can say that it's a supinated position, which is a standard position for IV cannulation. And the forearm and the arm here, we can see is extended and resting flat on the padded clean, like right on the padded surface, right here, yeah. And the fingers are relaxed and slightly curved inward, not like you have not tightly clenched or something. And right here is the wristband, is visible on the mannequin wrist. They showing the patient identification. So that hand position allows for optimal bend, like visibility and easily to access, especially for cannulation. Yeah. And we have done the preparation for the patient. So we turn to the procedure, okay? Right, so first we have to, yeah, first always we have to, you're right, we have to clean your hand with the alcohol gel. And then we're going to place the tourniquet. It is oh, I forgot to discuss about the tourniquet. It is a tourniquet. So we have to place the tourniquet around the arm. Yeah, yeah, that is kind of the first step after we clean our hands. Next, usually we have to palpate for the bend in the area. Yeah, so if you're happy with this bend, and then Yeah, I'm really happy with this fan. So we cleanse our hand again. And the first thing that we gonna do is put on our sterile gloves. It's kind of easy, right? And we will set aside the paper and we keep it aside to use it later. Okay, so the next thing I got is that small tube is the chloroprep, which it contains the disinfectant fluid. So we have to snap it. Okay, we have to snap it. Here is a snap it. Yeah, we have to snap it and then clean the area. Yeah, that's area that we will going to insert the cannula. And then uh, after like while that's drying, we are going to repair the flush. That is the flush. So that is the syringe that containing the 10 ml flush not of normal saline, and that is a extension, or we can say extension sets to connect the syringe to the cannula right here. After that, we after we will connect this head to the end of the cannula. Alright, so now we just going to prime the light. Alright, so we got the cannula here, and we have to remove the shelf. We there is the shelf right here. We have to remove it. You see it? You can see it clearly. Yeah, we can remove the shelf. And this time with the fingers on each wing. Right here on each wing we have the wings. So we have to put the fingers on each wing. And the we have to put the bevel off. Yeah, that's the bevel. We have to put the bevel off. So we going to insert at the roughly a 30-degree angle. Remember 30-degree angle, and we can put the gauze right there. Yeah, we have you can see it again that we have the gauze in there for the skin traction in the other hand, and then insert the cannula into the band. So we that is we call it a flashback. This is a flood. A flashback means a blood appearing into the cannula chamber, showing that it's a successful vein entry. So after that, we got the flashback, and then we withdraw the needle slightly, and then advance the cannula. Keeping a needle still. Yeah, we keep a needle still right here, and then we put the gauze right under the cannula right here to, to maybe blood can occasionally flush back. But in this case, there is no blood because it is kind of a mannequin. So that the cannula is now in. So we withdraw the needle, put the sharp spin right here. We withdraw the needles, and oh we withdraw the yeah. So we withdraw the needle and put it in the sharp spin right there and release. the tourniquet, release the tourniquet right there. Now with the that repair flush that we um, did prepare before, and then we remove the cap and attach uh, the extension to the end of the cannula. Then flush the flower through. It should feel nice and easy to go through. Alright, so then I just set it aside. Next, it put the dressing on. That is the dressing. There is two strips on the dressing. You can peel off. Yeah, that is. You can peel up and then go over each wing of the cannula here to secure it in place. And there is also a central segment to stressing. Remove that first. Then we remove the backing and place it either side in the cannula, making sure the insertion side is visible. Here, alright, alright. So yeah, making sure the insertion side here is visible and in the clear window. And finally, I'll remove the extra paper from the around the edge here. Remove the extra paper around the edge. And finally, you would usually label the dressing with the date, time, or your initials, a place that label over the top. Alright, so that's all done.